The Myeloma XI trial recruited around 4,000 patients from across the UK, looking both in those patients who were suitable for autologous transplant and those patients who were not deemed suitable for transplant, with a number of different analyses, both induction but also a randomisation for consolidation and maintenance. And in this particular meeting we've been looking at the randomisation in the maintenance setting between lenalidomide as a maintenance on its own and lenalidomide with the HDAC inhibitor vorinostat. And that was a part of the trial that was open for around 3 years, where patients were randomised to those two arms. And in that analysis, the data we presented here at this meeting is unfortunately endpoint was not met, in that the addition of vorinostat did not improve the progression-free or overall survival compared with using lenalidomide alone. And we previously presented last year the benefits of lenalidomide as a single agent as a maintenance compared with no maintenance at all, showing a highly significant improvement with a roughly doubling of progression-free survival. Adding vorinostat doesn't seem to improve upon that, and in fact our observation was that adding vorinostat actually increases the toxicity of the lenalidomide combination, and therefore relatively fewer patients were able to maintain maintenance. And actually in a sub-analysis that we've done, it would appear that that early stopping of the maintenance has actually contributed to the fact that it's not improved the outcome. Most interestingly though, and we know that HDACs, of which vorinostat is one, are really important in myeloma because panobinostat of course is used in the relapse setting. Most interestingly in the data, the subgroup in those who actually did receive treatment with the combination of drugs and were maintained on the combination for longer term, it does appear that those patients actually did better. Now unfortunately that's only an exploratory analysis and it's not going to be possible to prove that conclusively from this study, but it does indicate that actually still combining an HDAC inhibitor with an IMiD potentially does offer the advantages of maintaining longer term improvements in outlook, but the particular combination used in the study is not one that's going to be going forward.